sometimes it's something that you don't think that maybe you should handle until you're older, but when it comes to a sudden accident or something kind of, happening to you in your life, it's important that your family and your loved ones know your wishes in terms of what you would like to be done with your health. And ultimately,
Absolutely.
what happens to you if you should pass away. Well, Dr. Lisa Rosenberg, she's here. She's the medical director for Southwest Medical Hospice. It's a very difficult topic to discuss, because obviously you're dealing with the inevitable and sometimes you just don't want to face that reality. Right. So, there were 3 steps that I saw here that you say are important when you're trying to make these important life decisions. Discuss, decide, and then document. I like that breakdown. Let's talk a little bit about that.
So the first step is to discuss. So part of it is looking into your own preferences and values and deciding what kind of care you would and would not want in the face of an emergency or a sudden, very serious illness.
Right.
And then to discuss it with someone that we call basically a decision maker,
Right.
or a healthcare surrogate. So we can't really have a surrogate unless we've shared with that individual our values and say, this is a life I'd want to come back to. This is a life I wouldn't want to. I wouldn't want to stick around for that kind of phase.
Yeah.
So we have to discuss with the surrogate, and the surrogate also has to accept that responsibility.
That's very true.
I have had patients who said, "Oh, that would be my spouse," and then they come back and say, "You know what? She doesn't want that responsibility."
it's
And
a
I say,
lot.
"Well, then we need to pick somebody else, and we have to
Absolutely.
have the conversation again."
Yeah.
And then we need to decide. So we need to decide where our comfort place is, basically.
Of course.
At that point in time with those values, and people's goals change over time.
Sure.
And then document it. So it needs to be written down. It needs to be shared. We need to know where to find the information.
Good
so writing
point.
it down and sticking it in the nightstand, not so valuable. Leaving it as documentation in the primary care provider's office,
Right.
or with an attorney, whether it's in the case of advanced directives.
That's what I was going to ask. What does that documentation look like so people know what
Absolutely.
we're talking about?
So that documentation includes what our healthcare preferences are in a very general way. So it's not a menu.
Okay.
I do want this and I don't want this,
Right,
because sometimes they hang together.
Sure.
And if we're not a healthcare provider, we might not know which preferences go together. So we have to be careful about that. So it's a guide,
Right.
not an exact menu. And then actually an advanced directive ideally also identifies a person who can make decisions when the circumstances we face didn't fit nicely on the menu
I got
or the
it.
guide that we provided in advance. And they would say,
Sure.
well, based on my loved one's values, I think this is the way to go right now.
That's why that second step is so important, to discuss those values with someone so they
Yes.
have an idea of what your wishes may be if it doesn't really fit into the circumstances as dictated by the directive there. So these are just important discussions that need to be had, and ones that are difficult but need to happen. So we appreciate you, Doctor, for coming on and kind
My
of
pleasure.
breaking that down
This
for us.
is so important.
Yeah.
And the burden on families when an individual is not able to speak for themselves
enormous.
is huge, and it can cause rifts in families, and
Yeah.
it's heartbreaking. Even if you're not fighting with the sibling about what to
Yeah.
do for mom or dad, it's wrenching. So
Yeah.
if we can provide that information to our loved ones well in advance
It
and have
definitely
them
helps.
understand our values, it actually lifts the burden off families.
And that's a heavy burden to carry, that's for sure. Thank you, Doctor.
My pleasure.
Appreciate you. Michelle.